So yes, I don't know whether the theme of the day has been obvious to everyone, but we really wanted to take today to walk through different models of spay neuter services because there is no one size fits all approach. There's no this is the absolute best. Everyone must do it this way. In fact, I think there is a room and a need for multiple different models for spay neuter in the community. I think there's a place for everything. I think one of our presenters this morning said it best, we're never in competition, we're not competing, we're here to complement one another and everyone supporting the work that we're each doing. And so this morning we heard about, stationary high volume clinics. We've heard about MASH units from Pat Chan. We heard about mobile units from Dr. G. And here Rick DuCharme is going to talk to us about a new type of clinic model. And so thank you so much for tuning in. This is, let's see, going to be, I think, our last presentation of the day. And so I am going to just introduce you to our speaker now. His name is Rick DuCharme. Rick is the managing partner of Community Cat Clinics. We have 2 clinics in the northern suburbs of Atlanta that offer general practice affordable services, including spay neuter. We offer services to pet cats, community cats, rescue groups, and shelters. We strive to increase access to care for all feline families by providing affordably priced services, practicing incremental care, offering a variety of payment plans, and we have access to a nonprofit to help cover care when needed. He has a consulting company, RLD Consulting Services. He aids organizations and individuals in every stage of opening and operating a veterinary clinic, from design, planning, selecting, and establishing a business structure, vendor negotiations, team recruiting, and retention. One of his specialties is project management of clinic construction. So he's a handy one to have if you're thinking of opening a clinic. Previously, he founded and was the CEO of First Coast No More Homeless Pets in Jacksonville, Florida, an organization that he grew into a high quality, high volume spay neuter provider that performed over 25,000 spay and neuters annually, as well as provided care for over 60,000 dogs and cats in our lower cost clinics. While at First Coast No More Homeless Pets, Rick was one of the founders of the Target Zero Institute and an innovator and or refiner of many types of programs, including return to field, targeted spay neuter, mega adoption, spay neuter transport, and more. So with that, I am going to invite Rick to go ahead and turn on his microphone. And just a reminder, we're going to keep our cameras off till the very end when we have that question and answer portion. So thanks so much for being with us here today, Rick.
Hey, Brianna, thanks so much for that wonderful introduction. I appreciate it. Thanks for having me. And I just want to say thank you to Esther Meckler and Stacy LeBaron and the entire team that's doing such a great job at putting this wonderful conference on. There's not enough focus on spay and neuter, high quality, high volume spay and neuter in the industry anymore. And I really appreciate this group of people keeping that whole issue to the forefront. So, and of course, thank you to all of our wonderful sponsors. Before I get started, I thought I would introduce you all to Mew, the little tabby kitten on the screen right now. And Mew, the story of Mew really embodies perfectly the whole idea, the concept, and the reason why we started community cat clinics. Mew is a tiny little kitten, as you can see. His brother is there with him. And Mew's owner called us, and I just happened to pick up the phone that day. I was at the clinic, and she was very, very concerned and almost hysterical because Mew had eaten a rubber baby bottle nipple, and he was only 2 months old, so a tiny little thing. I don't know how he ate the whole baby bottle nipple, but and she had been to another clinic, a local corporate chain clinic, and they had quoted her $10,000, a little over $10,000 actually, to do the surgery, the exploratory surgery, and remove the baby bottle nipple from Mew's GI. And it was actually in 3 different parts throughout his GI system. So it was a fairly complicated surgery. And this lady had a newborn baby as well. So the baby was about 2 months old as well. So about the same age as Mew. And And we talked with her and, suggested she come in, and told her we were certain that we could do the surgery for quite a bit less than $10,000. And she brought Mew in, and he was very, very sick. And we were able to give him fluids and some pain medicines and stabilize him, keep him overnight in one of our heated cages, and do the surgery the next day. And the cost of the surgery was about $2,200. And it's exciting because the client could afford the $2,200, but very few amongst us could afford a $10,000 surprise veterinary bill. And she just was not capable of doing that. And no shock there. But she was capable of affording the $2,200, even though we were prepared to come up with some options for her on that even. But she was very happy. Mew went through the surgery just fine, and about an hour after the surgery, he was up in his cage and purring and rubbing at the bars. And every time anybody walked by, he was reaching out through the bars to get you to stop and pet him. So it was a great story, and we saved Mew's life, and the owner was very thrilled and happy. So it's just very exciting to see Mew and to get everything going for him. So that's really the whole concept behind Community Cat Clinic, is to provide services for people at an affordable price, to increase access to care and elevate the status of cats in the community. So we'll go on to the next slide. There we are. So like Bree said, I'm Rick DuCharme, and I'm the founder of RLD Consulting Services. And I work with organizations, both nonprofit and for-profit, all around the country, mostly in the realm of building veterinary clinics and spay and neuter clinics and helping them get them up and running. But I'm also the managing partner of Community Cat Clinics, which is what I'm here to tell you about today. And as Bree said earlier, I'm the founder and former CEO of First Coast No More Homeless Pets. So some of the things that we're going to go over in today's discussion is why feline focus? Why did we decide to put together a clinics that were basically just focused on felines? And Stacy and I, my partner, started discussing the whole concept of opening up some for-profit, affordably priced clinics that included high volume, high quality spay and neuter clear back in the summer of 2021. And we opened our first clinic in June of 2023 in Woodstock, Georgia, one of the northern suburbs of Atlanta. And by 2024, we had opened up our second clinic in Duluth, Georgia, also on the north side of Atlanta. So we'll talk a little bit about that process and about the Community Cat Clinic model, give you a little bit of information, a quick video tour of our clinic, and talk about some of the lessons learned, and maybe what the future brings for Community Cat Clinics. So a lot of people ask us, why just focus on cats? What is the focus on felines all about? And the fact is that I think probably everybody in this conference listening would acknowledge that cats often get the short end of the stick and are overlooked in both the nonprofit and the for-profit world. Now, recently, in the last decade, probably we've done better with cats in the nonprofit sheltering world, certainly, but we've all been to shelters where the cats are sort of an afterthought, and often the cat kennels are in a large closet off to the side, and dogs get most of the resources. And that's how it often is in mixed animal veterinary hospitals as well, is cats are sort of an afterthought. Providing services for cats are an afterthought, and the main focus of the clinics are on dogs. And so, there's just a lack of services out there also for community cats, or, outdoor cats or feral cats, whatever you prefer to call them. It's very hard for people to get medical care for community cats when they need medical care. And TNR services, spay and neuter for these cats, is also not as available. And often when you do find a feline only clinic in the community, it's sort of the boutique type clinic, which is really on the higher cost and really focused on low volume and amazing service, which is great, but along with low volume and amazing service has to come higher prices, and that eliminates a lot of pet owners, a lot of cat owners from using those. And of course, there's always more shelters and rescue groups and pet food banks that focus on the dog side of things, but often not on the feline side of things. In fact, one of the things we've noticed, or I've noticed in my work in animal welfare through the years, is that pet food banks often have lots of dog food available, but have a real shortage of cat food. So there's just an overall lack of focus on cats in both the for-profit and the nonprofit world. So the vision of Community Cat Clinic is really to create a community where cats are celebrated and provided with all the necessary services for them and their families. And that's a little bit hard to picture because we all know that with the increasing cost of veterinary care, whether it's spay and neuter or wellness care or sick and injury care, it's very difficult for low or even moderate income people to afford veterinary care. And so it just really struggles, people really struggle with getting veterinary care for their pets. And veterinary care, of course, includes spay and neuter. So the mission of Community Cat Clinic is to create a veterinary model that supports the needs of all cats in the community and their families, the clinic team, and the owners. So we want to be fear-free for both the cats that come to see us and the pet owners, as well as we want to have a great environment for our clinic team to work on, and to make a low return on the investment for the owners. And the reason we want to do all this stuff, and especially, we need the return on investment for the owners, is because we want to make a replicable model that can be duplicated all over the country to help elevate the status of cats, not only in the areas that we're working, but throughout the country. So our goal is to open these clinics and perfect the model, and then to really help people replicate this model around the whole country. So one of the goals of Community Cat Clinic is to eliminate feline clinic economic euthanasia. And we probably all in this room, in this conference, understand what economic euthanasia is. But if anybody isn't sure, economic euthanasia is when a cat goes to a veterinary clinic and there is a good prognosis for that cat if treatment is provided. However, the family is not able to afford the cost of treatment for that cat, and so the cat ends up, the veterinary clinic ends up offering euthanasia as the way to solve the cat's, to make sure the cat isn't suffering anymore. And that's horrible because it not only ends the cat's life much earlier than it should, but it really breaks that bond and destroys that bond between the family and the pet. And what does that do to the mental health of the family that loves their cat, wants to help their cat, but simply because they don't have the financial means, the kitty has to die. So that's a horrible feeling for everybody involved, not just the family, but for all the client or all the team at the clinic as well. The veterinarian, the technicians, and the customer service people, nobody feels good about that. And so one of our goals is to eliminate feline economic euthanasia. And I'm happy to say that we have never euthanized a cat due to lack of resources, lack of financial resources in either of our clinics since we opened. So of course, we also want to increase access to care. And of course, access to care includes spay and neuter. And a study by the Program for Pet Health Equity a couple years ago at the University of Tennessee found that back then, at least 25% of pet owners had experienced serious roadblocks or barriers to access to care for their pets in the last 2 years before the study was taken. So, and that number has probably increased even more since COVID and all the horrible inflation that we've seen, especially the inflation in the cost of veterinary care, which has greatly outpaced the inflation in the rest of the economy. And then we want to be fear-free, like I said, for our patients, our clients, and our team, and create a sustainable, replicable business model. So our model includes, our model is based on really a case manager or veterinary technician, veterinary assistant focused model. So we have 45-minute windows for our appointments. And in that 45 minutes, we call them case managers, but a lot of people call them veterinary technicians or veterinary assistants, is they'll go into the room and they'll be the primary contact for the pet owner, and they'll get the case history, talk about possible treatment plans, talk about any tests or x-rays or anything the veterinarian might recommend, and discuss the vaccinations and whatever else the kitty's going to need. And they'll be that main liaison between the pet owner and the veterinarian, so that they may go out and talk to the veterinarian, and the veterinarian to say, yeah, before I come in, go ahead and let's get permission to do an x-ray and this blood work, so we can really diagnose the kitty before we come up with a treatment plan. And then the case manager will get all that done and go back to the veterinarian and with the results, and then the veterinarian can look at those before going in and talking with the client. So it really is very dependent upon that case manager. And we have that 45-minute appointment window because we want those case managers to spend a lot of time with that client and educating the client on all types of feline husbandry, whether it's talking about litter boxes or behavior issues or medical issues, or discussing, maybe the client wants to talk about declawing, and of course we don't do declawing at any of our clinics, and so we can, our team is trained to discuss alternatives to declawing with the pet owner, and all types of other things, so that the case manager really is focused on educating that client during that visit. So we want the clients to leave feeling like they had a really good visit, they learned a lot, and were well taken care of. They were both well taken care of, and their kitty was well taken care of. So our goal is to benefit or elevate the feline status within the community, and we do this by benefiting the community in a variety of ways. Encouraging regular veterinary care for felines, of course, and we work with rescues and shelters in a variety of ways, and we'll touch on that just a little bit as well. We work with TNR groups. We have affordable spay and neuter for all. Once again, we want to eliminate economic euthanasia, so we just don't do economic euthanasia in our clinics. We find a way to help the people with their medical issues. And very important is that we're judgment-free with the clients. So if the client comes in and maybe kitty's 10 years old and has never been to a veterinarian in the last 5 years, and now is sick, and it may be something that could have been avoided had the kitty been coming in on a regular basis to see the veterinarian. But we don't judge the people for that. We try and educate them as to the importance of that. But we also realize that there could be all kinds of circumstances in their lives that we have no idea about. We need to take into consideration that they're doing the best they can for this kitty, and we need to help them from here on out, and do the best that we can to help them and their kitty. And then, of course, we want to educate the community overall. One of the benefits to the community, and here's a picture from our location in Woodstock, Georgia, that just shows the TNR room on a morning when we were doing a lot of TNRs. I think this day we did a little over 40 trap, neuter, return surgeries. We are set up to provide low-price TNR, and even as a for-profit organization, especially as a for-profit organization, that can be difficult, but we charge $65 for a spay or for a TNR surgery. And of course, that includes rabies and FBRCP as well as near tip. We have set up both of our clinics so that there's an entrance in the rear that high volume TNR groups can use, rescues and shelters can use, to bring in spay and neuter surgeries, cats and traps, and drop them off even when we're closed. So there's a keypad with a number code that we give to rescue groups, and they're able to access the TNR kennel room without without being able to access the rest of the clinic. So in both cases, they can access the TNR kennel room and the restroom. So if you're out trapping all night and you want to drop off cats, and you can also access the restroom if you need to clean up or whatever. And we have an inclusive surgery package, like I said, that's very low cost. And we try and make it easy for these groups to schedule and make it easy for them to drop off and pick up. So they don't even have to come pick up before we close that day. They can come after hours and pick up the cats, and if need be, drop off more cats for the next day's surgery. So we try and make it very easy to work with TNR groups. And to talk a little bit about our TNR kennels, is each of the TNR kennels has a separate HVAC system that allows us to keep the temperature set a little bit higher in there than what it is in the rest of the clinic, because the staff likes it cool in the clinic, but kitties like it warm. So we have separate HVAC systems in those rooms, and we have a vent that vents directly to the outside, and none of the air from that room is recirculated throughout the rest of the clinic. So it's all fresh air coming in and being vented directly outside. And we also play cat-friendly music in the kennel areas too, both the pet cat and the feral cat rooms. So try and calm the kitties a little bit. And we talked about eliminating economic euthanasia, and some of the ways that we do that are using incremental care. So using incremental care may be a way that, and using incremental care allows us to devise a treatment plan for the kitty that really works with the client's pocketbook. So, the kitty may come in, and a good example of that is the kitty that's in this slide here. This is Tansy, the big yellow kitty picture. Tansy came to us, and Tansy was blocked, had a urinary tract blockage. And it's not the first time he was blocked. He had been blocked before, and the owner had paid $5,000 at the previous clinic to get him unblocked. And then just a few months later, he was blocked again. So they called us, and we were able to get him in right away. We unblocked Tansy that evening and kept him overnight, and did a PU surgery on Tansy the next day. And we were able to work with the client to come up with a plan that involved several different payment options. So we set him up. He was able to pay part of the cost out of his pocket, and we used our Community Cat Champions Fund to pay enough of the cost to get him set up on the Verity payment plan that allowed him to make payments on the balance of the cost. And of course, we did it at a low cost. We did the PU surgery and the unblocking and the hospitalization for under $2,000. So we were able to get Tansy back healthy. The owner was thrilled because he was very attached to this kitty, and everybody was happy and healthy and went home. But incremental care can also be used in a spay and neuter example, because say with a spay or a neuter for a new patient of ours, a pet cat, probably what we would recommend is kitty come in for a checkup before and to go over everything, and and we offer fluids, or we offer a variety of different services that could come with spay and neuter. But if the patient's really price sensitive, we can just do a quick exam the morning of surgery, so they don't have to make an extra trip in. So it may be that they, even price sensitive isn't the concern. Maybe it's getting off of work 2 days in a row to come in for a pre-surgical checkup and then come back a day or two later for a surgery. So we can schedule that quick exam the morning of surgery as well. And we can offer, surgeries that meet high volume, high quality spay and neuter guidelines, but maybe aren't the typical guidelines that you would see in a for-profit regular veterinary practice. But we also, we know where we fit in that spectrum of care. So spectrum of care to me and incremental care are two different things. Spectrum of care is the whole array of different types of ways that you can get veterinary care for your cat or dog, for that matter, whether it's a vaccine clinic at a pet supermarket or a PetSmart, or you're going to a spay and neuter, high volume, high quality spay and neuter clinic at a nonprofit. You may be going to an affordable care for-profit clinic like ourselves, or all the way up to specialty care at a specialty hospital. So that to me is spectrum of care. And of course, with payment plans, we have a variety of payment plans available. We have care credit, we have scratch pay, we do Verity payment plans, and we also have in-house payment plans. And then we can also tap into our charitable fund, Community Cat Champions, if need be, to help people. And one thing that's not listed here that we do utilize as frequently as possible is the AVMA fund that helps to cover the cost of surgeries for people. And any veterinarian that's a member of the AVMA can access those funds for up to $2,000 a year to help to help with the cost of a surgery, a life-saving surgery. And the application process is very simple, and you get very quick approval and payment. So we utilize that whenever possible. Each of our veterinarians is able to access that for up to $2,000 a year. And once again, like I said, we're judgment-free clinic. And going back to that 2018 Access to Veterinary Care study that the University of Tennessee did, 10% of pet owners didn't seek veterinary care because they were concerned about what the provider would think, that the provider would think badly of them. So we're very careful to make sure that we are judgment-free. When clients come to us for help, we assume that whatever reasons they had for not reaching out before, they're here now, and that's the important thing. And we're going to figure out how to help them from here on out. And one part of this is making sure that our team practices this not only when they're face-to-face with the client, but when they're in the clinic later in the day, or they step out of the exam room. We don't want to say, oh, this person's horrible, they haven't brought their cat in for whatever. No, we want to be judgment-free throughout the entire clinic and throughout the entire process. So we definitely try and discourage any type of negative discussion about our clients at all throughout the clinic. So obviously, if we see abuse or something like that, then we have to take steps there. But for the most part, we try and just assume that pet owners are trying to do the best they can for their kitty, and we're there to help them help them with that. And one thing that people that Access to Care study found, and that I realized in my work with the University of Tennessee Aligned Care Health Program, is that minorities often face extra challenges work coming into a clinic and have extra concerns, especially when often the people working in the clinics don't look like them. And so we do try and have a diversified team whenever possible in our clinics as well, but also just realize that everybody coming to us may be facing different challenges or having different struggles, or just make sure that we're not having any biases in the way we deal with people. And economically disadvantaged pet owners have an entirely different yet similar set of concerns. When they come in, they're struggling with, geez, is this visit going to cost me my car payment or my rent payment? Am I going to be able to pay the utilities if I pay for the veterinary care? So we just have to realize that everybody coming to us is struggling with different types of issues, and that our job is to be there to help them and support them. So how do we fit into the access to care puzzle? Because of course, access to care means a lot of different things, and people working to find veterinary care for their pets have a lot of different ways to reach that. And so there's low-cost for-profit vaccine clinics, the kind you see set up at the Walgreens or the Tractor Supply. There's, of course, free vaccine clinics that nonprofit organizations are putting on all the time. There's indigent care clinics like the Street Dogs Group and the different different nonprofit organizations that put on different types of clinics for indigent people. It's, it's the unhoused and so on. And we're sort of right in the middle. So we're affordable care nonprofit clinics, and then there's affordable care for-profit clinics, which is where we fit in. There's a lot of nonprofit organizations that are now realizing that access to care is spay and neuter, but it's also so much more than spay and neuter. And then, of course, there's nonprofit surgery centers. There's a great surgery center here in the Atlanta area called SurgiPet. That's a nonprofit organization that provides surgeries other than spay and neuter at very affordable costs. Then there's, of course, the for-profit urgent and emergency clinics and the specialty centers. And so we may be referring clients up to some of these other options if need be, and some of the vaccine clinics and such are definitely referring clients to us. So we sort of are right in the middle of that access to care puzzle. So some of the things that we've learned in opening our clinics is that there's a huge demand for dentistry, especially in felines, and affordably priced dentistry. And so right in each of our exam rooms, we know that, often people struggle with affording the cost of dentistry. And, with our services, dentistry we try and keep it affordable, but, if you're struggling to pay the bills and, living paycheck to paycheck, any cost can be unaffordable to you. So we talk right off the bat with clients, we talk right away with clients when we recommend dentistry to them about the options we have for payment. We have a card right in each exam room that talks about here's what your payment would be if you use Care Credit, or here's what your payment might be through Verity or Scratch Pay, so that we can help people visualize how they can afford these services when they need them. One thing that we learned is that the demand for spay and neuter isn't always what you think it would be. In our first clinic, there were no real low-cost spay and neuter clinics in the neighborhood, and so we thought demand would be really high there, and realized that it wasn't as high as we thought it was going to be. But then in the second clinic we built, we're actually right down the road from a nonprofit organization called Planned Parenthood, which is a great nonprofit. So we were fully prepared to not see as high a demand for P&R services and spay and neuter services there. And we quickly realized that the demand at the second clinic was even way higher than expected. And that was because the Planned Parenthood, the T&R and spay and neuter clinic right down the street, was referring a lot of clients to us that they couldn't get to. So they were so overwhelmed with demand for their services that they every day refer clients to us that need help with spay and neuter. And special surgeries, we found too that there's a huge demand out there, and we're getting referrals from a lot of other veterinary clinics, ERs, and urgent care clinics. People come into an ER with a kitty that is, maybe blocked or has a foreign body, and they do some testing and find out what the problem is. But after doing all those testing, they've taken all the client's money, and so now the client still needs the surgery, but they've spent all the money they had available, $1,500, $2,000 on lab work and x-rays or ultrasound. And so often the ER, the urgent care place, or even other veterinary hospitals will refer people to us because they know that we're going to work with the client and figure out a way to get the surgery done, even if they don't have the funds available immediately. So, special surgeries, there's definitely been a higher than expected demand for all those types of surgeries. And then sick versus wellness appointments. We found that because we're affordably priced, and with cats especially, it seems like people wait until kitty is sick before they call the veterinary clinic instead of doing regular wellness appointments on a regular basis, that we're seeing a higher percentage of sick appointments in our exam rooms than what we would have expected. So we thought that we would see a lot more wellness appointments and fewer sick appointments, but come to find out we're seeing a lot more sick appointments. So that's a challenge that we've really had to work with. And so in our clinic, we've worked to adhere to fear-free design concepts. And all of our team is fear-free certified, although we are not a fear-free certified clinic. But we are focused on being very cat friendly and a very functional design. So when you come into our lobby, of course, the whole facility is painted in very calming colors that I've been told are feline friendly, but are certainly pet owner friendly as well. In light pastels and so on, no whites, no bright whites especially. And in the lobby, we have with each seating area, we have tables so kitties can be set up on the table in their carriers, so that the cat doesn't have to sit on the floor, because we all know cats like to be up higher, and sitting them on the floor just adds to their stress. We keep the sound level throughout the whole clinic as low as possible, so our team is trained to not be loud, and we've worked to put in soundproofing between our space, because we're in strip malls, between our space and our neighbor's space, so that the noise from the adjoining stores doesn't carry over into ours. You know, the exam rooms are set up to be feline friendly. All of our cages come with heating, so that the kitties can be heated in the cages so that they keep warmer. My good friend Dr. Julie Levy is always telling me kitties like to be warm, so we've tried to make that happen throughout the whole clinic. In our treatment area, there's half walls between the treatment stations so that the kitties can't see each other, but our team can still look over the top of the walls to see, make sure that the people next door don't need additional help. I don't know how well you can see this, and I can certainly send you the blueprints if needed, or if you're interested. But this sort of gives you the design. So you see that we've got you come in the front, I guess I don't have, oh, I do have, I don't know if you can see this, but you come in the front door here, and we have the lobby area here, and off to the left are the exam rooms with entrances in both the front and the rear. And we have one exam room that's extra big with really comfortable seating and lower lighting that we can, dimmable lighting, so that we use this for euthanasias as well as other things, but just to try and make it a little bit more more friendly for the clients if they have to have their cat euthanized for medical reasons. Then we have the pharmacy in the back here. X-ray, sonogram, and endoscope are in this room here. Then the hospitalization area is here, and here's the treatment areas. And as I mentioned, there's half walls between each of those treatment stations so that the kitties don't see each other. There's still some visibility from kitties in the hospital area to kitties in the treatment area. However, we had to keep in mind that the veterinarians and the team need to be able to see the hospitalized kitties, at all times, to make sure everything's well with them. Have the lab and pharmacy here, so we have full array of in-house laboratory, as well as we use Antech to send out lab work as well. So, and that comes back to incremental care. Some people may want, quick response on their lab tests, and sometimes we need a quick response on the lab tests, so we can do those in-house. But if, in order to save the client's money, if it works for the medical needs of the kitty, we can send out lab work as well, and that's usually a lot less expensive than doing it in-house. And then this area over here, I'm not sure if you see, is our radioiodine therapy treatment area. So we actually have the ability at both of our clinics, it's designed so that we can treat cats for for hyperthyroidism using I-131 radioactive treatments. And that's something that's very expensive. The University of Georgia and RadioCats here in Atlanta are the only two places in the state of Georgia that offer that service. And the University of Georgia, I just saw an invoice from them, or a quote on them. It was over $4,500 for the cost of that treatment, which we're offering for about $2,200. So This is an area that we can do radioiodine therapy treatments here. Right now, we're only offering that at one of our clinics just because it takes a long time to go through the the state um, the state qualification and get the state licensing to do that. Then in the back here, you can see we've got the prep area for spay and neuter. We have 3 prep stations, and in the surgery room, we have 3 surgery stations as well. The beach is right here. We have an elevated beach because we're only dealing with kitties. We don't need to have big dogs laying on the beach, so we've got an elevated area for beach, and of course that's heated as well. Then this is the pack prep area over here um, for putting together the packs, and uh, the the autoclaves are here. We have an oxygen generator that's big enough to facilitate all the oxygen we need in the entire building. So we can operate 13 anesthesia machines and the ICU cages, oxygen cages off of our oxygen generator, which is a big investment, but in the long run, it'll pay off by not having to continually buy oxygen for the building. And then we have 2 dental stations here. You can see our dental machines are operated off of nitrogen powered rather than air compressor powered, which is a lot quieter, a lot better for the team. Of course, the kitties are sleeping by the time they get to that point, so it doesn't really impact them, but it's a lot better for the team. And then down this hallway is the pet cat kennels and the feral cat kennels. And you see there's a rear door here, and there's a keypad there that allows the rescue groups to get in, and they can either drop off pet cats into this room or feral cats into this room for surgery the next day. And there's a door here that is locked then that they cannot access the rest of the clinic. But like I said, they can access the restroom and the feral cat or the pet cat kennel areas. So, and that's only for rescue groups that we work closely with, but we have a strong relationship with lots of rescue groups and shelters, smaller shelters in the community. So one thing, that we learned as we were looking to find a place to locate the clinics is that we wanted to be in high traffic areas. And so this is our Woodstock clinic here, and you can see we're in a strip center that has a Walmart in it. And so our clinic is right here, and there's a lot of traffic going in and out here to go to the Walmart. And so we get a lot of clients that just drive by the building and see us there, and it makes it really great. There's lots of parking, which for those of you that run spay and neuter clinics, parking is always an issue. We have plenty of parking there, and we are able to access the clinic from the rear as well. And I found that as building these out, it's important to bring an architect onto the team as early in the process as possible, so that they can help with, looking at the building and help you figure out, will your floor plan or will everything you need fit into the space that you have, the footprint of the building. And, one thing that we've learned too is having the contractor involved pretty early is helpful as well. And I've definitely learned that when the contractor gives you a timeline, add a few months to that timeline, because they're probably doing a best case scenario. And there's always going to be issues, whether it's something you find in the building that was not anticipated, some sort of construction challenge, or permitting, or maybe delays in supplies. So always be generous in that timeline. And I think we're running out of time here. Bree, just let me know if I've got to.
I think everyone is loving this presentation, so you keep going there, Rick.
Okay, I'm sorry. Yeah, I talked about most of this stuff already. We do offer radiograph, sonogram, and endoscope in both of our clinics. Do a lot of dentistry. You can see here our Snyder ICU cages have, the capability for heating and cooling, also oxygen in these, and then all the other cages, all the other hospital cages do have heating available in them too. So the floors are heated so that the kitties keep the kitties warm. And then staffing, I know all of us are struggling, many of us anyway are struggling with hiring veterinarians, and we have tried everything to hire veterinarians. We've hired recruiters to hire veterinarians. We've advertised on all kinds of different websites and apps, Vet Recruiter, Indeed, LinkedIn. We've just done everything we can, and I've got to tell you, the best place to hire veterinarians, as far as I can tell, is the AVMA website. That's the only place that we've ever been able to recruit veterinarians from. That doesn't say, don't try some of those other things, but I think using the AVMA website and then using your networks, put it on Facebook, go join, there's a high quality, high volume Facebook page for hiring spay and neuter veterinarians, be sure and post there and, use your network to hire as well. But the AVMA website is where we've always hired our veterinarians from. And as far as practice managers, customer service, and technicians and assistants, it's Indeed. I've tried a lot of different places, spent a lot of money on a lot of different places, but I think Indeed is probably where, at least in the Atlanta area, where we find all of our team members from, as well as word of mouth and networking. And I think that was my entire presentation. If we have time for question and answers, I'm certainly willing to. Oh, we've got a quick video to show. So can we show that video?
I've always loved cats. I've had cats since I was about a year old. I have 12 cats.
I have 5 cats. I have 3 cats, 2 of which I rescued from the DNR program.
I have 2 cats. They're 2 little kittens. They're about 13 weeks old.
I have 3, and they are the loves of my life.
The mission of community cat clinics is to increase access to veterinary care for pet owners of all income levels. When you come to us, our team members are specifically trained in feline care, and all of our equipment and design of the clinic is specifically set up for cats only.
All of our members are fear-free certified, so that helps to keep the patients calm when they come in. It also helps to keep the owners calm. We use different pheromones plugged in our rooms.
It comes down to the surfaces that the cats are placed on. It comes down to our treatment area where we have partial walls so the cats don't have a direct line of vision to each other when they're on a table. The cages are heated as well so we can temperature control them so they're never on a cold surface.
All 3 of our doctors are exclusively passionate about feline medicine, and they also have a lot of experience with handling just felines.
We also want to help the communities, rescue groups, shelters.
Whether it is spay and neuter, whether it is medical care, whether it is dentistry that they might not be able to afford by going to a specialist.
We also do surgeries. We have x-ray capability, ultrasound, radioactive iodine therapy for cats that are hyperthyroid.
We're locally owned clinics, so that gives us the flexibility to be able to design our treatment plans and our overall treatments to the needs of our clients without having to follow strict corporate protocols.
We don't ever want a client to have to make an economic euthanasia decision
just because they can't afford something when they have a good prognosis.
That means that we never euthanize a kitty whose life we could save just because the client cannot afford to pay for the cost of the care.
We support and we encourage our clients to ask questions. We encourage our clients to be involved in that care and helping clients make educated decisions about the overall well-being of their cats.
Well, that was beautiful. I have had the privilege of learning about the community cat clinic. I've seen a couple presentations now on it, and I got to tell you, every time, Rick, it warms my heart. And I'm looking at folks in the comments, and they're all going, "This is outstanding. This is gorgeous. How do we get a clinic like this?" And I know when you start talking about the TNR room, the specific, the intentionality behind having a drop-off space where those cats in traps can be left, in a controlled environment, that's kept at the right temperature. I know for our community cat audience out there, that had to warm their heart to see that is such a, built-in part of your model there.
Yeah, it's right from the start, I had some great mentors helping me figure that out with the team at Community Cat Podcast and Dr. Julie Levy, and just and of course I have lots of experience working with TNR surgeries and taking care of feral cats coming in traps. So it was definitely a focus of us right from the start. Not only even before the design of the clinic started, but looking at space and making sure it had a rear entrance so that we could access and be able to pull cars right up to the rear entrance and unload them right into the feral cat room. So it was something that we had to intentionally design into the clinics and make sure we had.
And that intentionality, it's throughout the space. I mean, right down to having the cages heated. I mean, how do you do that? Is that a special cage that's required to make them heated, or how did you figure that out?
It is. It's you can buy them, and most of our cages come from Snyder. Now, the downside to that is it's expensive. So your capital costs are higher to start with, but it's an investment well worth it to keep the kitties, warm while they're there and make sure that their body temperatures are kept up. But at the same time, you can keep the the overall temperature in the clinic cool enough to make sure the staff is comfortable as well. So it's a bit of a challenge, but it's a trade-off well worth it to make sure that the kitties are warm and healthy.
Absolutely. And so I jotted a couple questions down, and again, your reminder, everyone, to go ahead and drop those questions in the box for us, and I'll try to get to as many as I can as we're wrapping up here today. But I am in love with this idea of incremental care, and how that works for folks, because I know I have been, I mean, just out of college, and my first, like, I call it my first big girl job, like working full time, and I had 7 cats in the house. And so, like, what I was able to afford for 7 cats was quite different. You talk about that worry of being judged by your provider, like that was absolutely me. And so, I mean, I love them. I did the best I could for them. So I'm wondering if you could speak a little bit, like, so, for instance, like, someone brings a cat in that has like kidney disease, like, so how does incremental care like work for that person? Just kind of explain that process again.
Well, I'm not real up to date on the veterinary end of things, so I can't speak specifically to kidney disease, because if I try and say, this or that, somebody's going to be like, oh no, he doesn't know. But really, how incremental care works is, and really veterinarians have been practicing it for decades, but now with the advent of the corporate veterinary clinics, often veterinarians' hands are tied when it comes to practicing incremental care. But say if kitty comes in and is having issues that may be kidney disease or maybe something else, and the veterinarian sort of looks at the kitty, here's the symptoms, and says, well, I'm pretty sure this is whatever, and if we give the kitty antibiotics, it'll probably make it better, but in order to make sure that this is what it is, we should do this blood work and we should maybe get some x-rays. And the client's like, oh, I only have $192. I emptied out my piggy bank before I came here, and that's what was in it. And so maybe the client can't afford x-rays. The veterinarian's 90% sure that this prescription of antibiotics will take care of the kitty's problem. So after talking it over with the client and making sure the client understands the implications, then maybe you go right to prescribing the antibiotics and skip the blood work and skip the x-rays, but make sure the client understands if kitty isn't starting to get better right away, kitty needs to come back in, and then we will have to do the blood work and we will have to do the x-rays to figure out what is wrong with the kitty. And that's been the case. I remember going to the veterinarian when I was young with our dogs, and the vet would be like, well, we could do a skin scraping and send it off for this or that, for cultures. But I'm pretty sure what your dog's got will be solved by this medicine. You want to do the skin scraping, or you want to just go right for the medicine? And my parents, were not wealthy, so they would be like, well, let's just go right for the medicine, and then we'll see what happens. And and 9 times out of 10, it would cure the problem. But if it doesn't cure the problem, then it involves another trip to the veterinary clinic and probably doing some of those things that you skipped. I really learned about incremental care at First Coast No More Homeless Pets. We were seeing 65,000 clients a year, and most of them were struggling financially. But then when I started to work with the University of Tennessee and Dr. Michael Blackwell, he's sort of the king of incremental care and really getting promoting that throughout the veterinary industry. And so in the handouts that I sent, and I believe you guys have provided to the team, is the study from the University of Tennessee Program for Pet Health Equity that discusses the access to care problem. And then there's a follow-up study on their website that sort of discusses how to solve the access to care problem. So I would recommend checking those both out for the team, or for the listeners. I'm sorry.
Yeah, no. And so we did have a question, again, with that TNR room and the model that you guys have on your pricing. So like, how does that work when a rescue is working with, like, in a low cost community where there are 30 cats or something that they are trapping all at one time, and like no one can afford to pay much at all? So, I mean, how does your pricing model work for like TNR groups and mass trapping?
It's definitely a challenge. And of course, the $65 is low cost when you compare it to a lot of places, but it's not low enough cost when, like you said, you may have 30 cats or so on. So we try, and through the Community Cat Champions, we look for grants as well, but we also encourage the TNR groups and the rescue groups to look for grants themselves, but also to do fundraising, because they're all nonprofit organizations. So they can try and do some fundraising, or do a waggle account or something like that to try and raise funds. And there are sometimes government programs available in some of the communities that we are in. Various, this county or the city may have some funding to cover feral cat surgeries as well. So it's always a struggle to piece together the payment for those, because we are not a nonprofit. And even if we were a nonprofit, nonprofits and for-profits both have to figure out how to pay their bills, how to pay for the staff, how to pay for the building, the overhead, the drugs, the surgery supplies. There's got to be a way to fund the surgeries, whether it's a nonprofit or a for-profit. The money's coming from somewhere, and we're no different.
And so, I mean, what was the decision making behind being a for-profit as opposed to, registering this as a nonprofit clinic? Was there any like intention there? Are there pros or cons to being one or the other?
There's definitely pros and cons to both. Now we tried to, we do have the Community Cat Champions that acts as our nonprofit arm that also not only helps fund treatments within our clinic, but also at other clinics, but we give grants to local TNR groups and rescue groups to buy traps or to pay for other equipment that they might need. We also have a scholarship program to help people fund education. So there are, that does help us offset some of the negatives to being a for-profit. But the overall reason why we picked the for-profit model was because we wanted to make this replicable in other communities. And that was a good way to ensure that if we can be profitable doing this model, then other people can try it in those communities as well. And just because it's a for-profit model doesn't mean that nonprofit organizations can't replicate the same model, because it doesn't hurt a nonprofit to have a little extra money left over at the end of the year as well. So they can plow those extra funds right back into doing free TNR surgeries if they want to, or free providing care for medical issues or whatever.
And to that point, do you franchise this model? What if someone wants a community cat clinic in their neighborhood?
Definitely, if somebody wants a community cat clinic in their neighborhood, reach out to us. We're still perfecting the model to make sure that it is economically sustainable in the long run. And but yeah, we are definitely open to working with people if they are interested in opening up a community cat clinic in their neighborhood. Now, that's not to say that we have the funds to open up a clinic in your neighborhood, but if you have the funds, or if you're interested in finding the funds, we can certainly help you set up the model, and we'll figure out a way to support you and work with you. And we haven't quite got the whole franchising or licensing idea put together totally yet, but that's never slowed us down in the past. We're willing to do whatever it takes to make things happen.
And so I'm curious, just because we have learned a bit about how the vet community kind of works, and we've talked a bit about the emphasis of, the perception of high quality, high volume services and that sort of thing. So what has been the reception of the community cat clinic in Atlanta, especially where other, vet practices are concerned?
I mentioned earlier that we opened up right down the street from a nonprofit spay and neuter clinic. So they were a little concerned at first, not that we would take their business, but that we might take some of their staff. And I think, probably in the veterinary world today, that's probably the biggest concern of clinics out there is don't steal our staff. We got plenty of clients, but don't take our veterinarians and our veterinary technicians. But the longer we're in business, the more we're realizing that other clinics are sending us clients and referring clients to us that maybe can't afford the services at their clinic, or maybe they've like I said earlier, they've done the lab work and the diagnostic work, and the people have run out of money, and now they've diagnosed what's wrong with the kitty and it needs surgery, but the client cannot afford a $10,000 surgery. So whether it's the veterinarian in the clinic or the practice manager, or maybe one of the customer service people just slipping them our phone number, it's we often get a call from somebody that's in the lobby of a clinic somewhere else that needs our services, and we get them right in whenever possible and try and get them get their kitty cared for.
And just a couple more questions as we wrap up. I'm just curious. You mentioned the importance of it being a judgment-free space, and your video made it clear, everyone that was talking, of how passionate they are about feline-centric work. Is there any training, like how do you preserve that culture and making sure that your team can preserve that non-judgmental attitude working with all your clients?
There should be more training available for that, more formalized training. We do our training in-house on that part especially. And when we hire technicians now, case managers as we call them, they work in our first clinic for the first couple weeks and get trained by the team over there as far as that goes. But we also just have to remind each other constantly, that, hey, it's not appropriate to talk about that person and about that kitty. And we just have to know that them people are doing the best for the kitty that they can right now, and we're going to help them moving forward. And some of our team came with a bit of a challenge in that area, but we worked with them and got them into the right mindset. So it's just sort of an ongoing thing that we have to sort of hold each other accountable to, because it is so easy to judge people. If they come in and and kitty's not in good shape, and you can tell that they probably have not been, or they tell you they haven't been to a veterinarian in X number of years. It's easy to not consider what circumstances that person may be facing, and just look at the outcome and judge them from our point of view and our set of circumstances, and not their own circumstances.
And so if folks are interested in learning more about your model, how can they get in touch with you?
They can email me at rickd@communitycatclinic.com. If they like, they can reach out to me on Facebook. I'm on Facebook, Rick DuCharme. I'm not on some of the other things. I'm on LinkedIn. Send me an email, or you reach out to me through Messenger, and we'll set up a time to chat and figure out what we can do. Well, both of our clinics also have Facebook, Community Cat Clinic and Community Cat Clinic Duluth, so feel free to check those out. And just sort of, there is a tour of the clinic on the Facebook page, Community Cat Clinic, so feel free to check that out as well. But yeah, reach out to me any way you want. And Brianna, are you going to send out our contact information to everybody, or will they have that?
You know what? I can make sure that folks have that follow-up as part of our, if it's not in your slides, because your slides are included in the handouts, everyone. So if it's in your slides, your email will be there, and we'll make sure that we get your email out to folks. And so again, that's rickd@communitycatclinic.com. Is that right?
Correct. Yeah, just reach out to us. I'm happy to chat with anybody and help them, to help them figure out what the next steps are for their community and their organization.
That's awesome.
It's in the slides. Kristen just said it was in the slides, so perfect.
Perfect. All right.
Thanks, Kristen.
Thank you. Yeah, thank you, Kristen, and thank you, Rick, for that awesome presentation. Like I said, I love what the community clinic has set up down there, so I'm eager to see where you all go from here.
It'll be exciting wherever we go.